working with the Ministry of Education. We have a number of guidelines, for instance, on mpox, that outline the various standard operating procedures that will be followed in schools as the pupils and students go back today. And all the institutions are already aware of all these standard operating procedures regarding the prevention and prevention of both mpox and also the Sudan Ebola virus disease. We have already, last week during the declaration, we outlined the signs and symptoms of Ebola virus disease, and this communication has already reached the various institutions, including schools, and we expect high level of vigilance and alertness such that we are able to get any alert that may arise in the schools. So I wish to confirm that we are working with all the institutions of learning to ensure that we control the spread of mpox and also curb the transmission or importation of Ebola into the schools. And I wish to say that the Ministry of Health is on top of the situation. We have already listed over 234 contacts to the index case, and we have already deployed a mobile testing laboratory in Mbarara to ensure that the turnaround of the samples is done quickly. And to date, we have picked two cases who are close relatives to the deceased case, who was the index case. And we already have these receiving treatment. They have already received the compassionate Ebola vaccines. So we have people who are under isolation in the treatment center that has been set up at Murago. There's a Murago Isolation Center. We also have the health workers who are in contact with the index case that are under quarantine at a designated facility. So I wish to array any fears and anxieties and state that the Ministry of Health is fully in control and will be able to control this current outbreak in record time as already exhibited, because the Ministry of Health has a great track record of responding to viral hemorrhagic fevers, and this being the 8th outbreak, will be able to contain it in the shortest possible time. Someone asked the source. Of course, to date, we are still conducting investigations in the potential source of the infection. I cannot be able to say where it emerged from, but our teams are still investigating, and we'll be able to update you at a later date once the investigating teams are done with their work. In terms of the other diseases that will be screened, of course, the Expo supplements screening services, and working with our partners like the Dental Association, they have committed to screen for all health-related conditions. We already have the eye screening services, the orthopedic services. I also see the IVF, which is to do with fertility. They will be screening people who have had challenges in having babies. You will be able to consult and establish what is the challenge. So those services will be available. So there are a few services that are able to be offered, but I appeal to those ones who have any medical-related conditions to visit the nearest public health facilities for screening, because like cancer, screening is always available when you go to the Uganda Cancer Institute. So we encourage each and everyone who wishes to make a consultation to go to the Uganda Cancer Institute, and any other condition you can go to the public health facilities, because every day there are consultations that happen. The opportunity cost, that question, I will hand it over to Harriet. What is the opportunity cost of holding this expo and the statistics on the imports to do with manufacturing? I hope I've responded to all your questions. Thank you very much. I'll invite Harriet, and also maybe I think all those were the questions. Harriet can make some remarks.
In terms of oral health, I need to note that unfortunately, most of our Ugandans are not aware of the need to visit dentists, probably because they don't find it as important. So a few years ago, the statistics were a bit lower, but now they have actually gone higher. And the latest statistics that were being shown was that in children, the rate of caries, dental caries, which are cavities in teeth, was above 40%. And that of adults was above 62%. But that is even for minute populations that were able to participate in the study. We've not yet had a national oral health survey to get what is happening at a household level and community level and in all districts. And why are caries or dental caries, what we call cavities or holes in teeth, on the increase of late in children is because it all comes from we, the parents. So most of us have not probably grown knowing which food to eat, how to take care of our teeth, and so the little information we don't have anything to extrapolate to our children. So our children are getting exposed to a lot of confectionaries. Those are sweets, the cakes, the chocolates. I don't know whether there are any companies here that manufacture sodas, all those things that are actually destroying the children's teeth. Unfortunately, our culture as Ugandans is that to appreciate a child, you have to give them a sweet. And each sweet you give is probably like 500 shillings if it's expensive. But in the long run, the cost of tooth decay is quite high, because by the time the child makes probably 18 years, they've lost a number of permanent teeth. These are teeth that cannot be replaced, cannot grow again at the age of 18. And so it's difficult to find a 30-year-old that is actually still having the 32 permanent teeth that someone is supposed to have. So it's also for schools administration, whatever they put in the canteens, the sweet things, the sugars, if they are not regulated, we are still having a high rate of tooth decay among children. Even all the way from the feeding practices, whereby we are still using bottles, and then adding sugar to that milk is also doing more harm than good to our children. The other thing that I would also have to mention is that even the brushing, some of us do not brush our teeth at all, or don't find it relevant to brush teeth. So we always encourage, if you visit the dentist while you're expecting, that it's good, even when you see the first 2 teeth out, you have to start brushing. Some people do not know that a child's teeth have to be brushed. So this is carried on till the adult stage, the time that child closes 6 years, that even the baby teeth that are supposed to be there by then have already been lost. Not because of the normal shaking process of the teeth that we lose, but because of dental caries. And in the long run, that's why we have a lot of malaligned teeth right now, people wearing braces. It's not fancy, it's not fantasy, but there are some errors we make, often at childhood level, and there's premature loss of the baby teeth. But then also later on, the habits we also take in, the tongue sucking, also the thumb sucking, all those habits really compromise the health of the children. So as the Uganda Dental Association, we are encouraging everyone to come and participate in this expo so that you actually get to know facts and not hearsay. Thank you.
Doctor, before you go, I wish to first have your Uganda. Yes, what you presented again.
Disclaimer, I'm a Muganda, but Alaba. Amanya gange, nze musawo Nachonyi, Maria Goretti. Nga nkiikiridde ekitongole ekigatta abasawo b'amannyo kye bayita Uganda Dental Association. Omulimu gwaffe mu nsi yaffe kulaba nga buli ssekinnoomu asobola okufuna obujjanjabi obw'amannyo obwetaagisibwa mu bitundu byonna ebyensi yaffe ebya Uganda. So tukubiriza nti buli ssekinnoomu bw'oba ng'oli awo nga tulabangako musawo w'amannyo emyaka gyo gyonna newankubadde bwamulabako naye nga tewasobola kebera kamu ako bwe kafaanana nga 13 paka 15 guno omwezi tubayita mwenna mu lukuŋŋaano olunene olwa Uganda Farmer Health Care 2025. Tubasaba mwenna mujje tubeereyo tukebeze amannyo gaffe. Tugenda kebera ku bwereere, tewali bisale bye tugenda kusasula. Bw'oba omanyi okimanyi nti ebisale by'amannyo bya bbeeyi, kati sooka ojja okendeza ebbeeyi nga tukebera ku bwereere, tukugambe n'ebyokukola engeri bw'okulabirira amannyo go ag'abaana bo n'aga famire yo. So tubayise mwenna musobole okulabikako nga 13 paka 15. Ffe ng'ekitongole ky'abasawo abajjanjaba amannyo tugenda kubeerayo era tubasuubiza tugenda kubakeberako tuddemu ebibuuzo byammwe byonna ebyetaagisibwa. Waliwo ekibuuzo ekibuuziddwa ekya figures ez'abantu abalwadde b'amannyo mu Uganda. Nkoze kya mugaso nnyo okutegeera nti ffe nga Uganda oba abantu abasinga mu Uganda tetubadde na mukisa kutegeera omugaso gw'amannyo gano n'akamwa kaffe mu bulamba. Kati research yakolebwa emabegako awo yali alaganga emiwendo egikyaliko wansi naye gyeyongedde. Statistics ezasembayo ziraga nti ng'abaana mu baana obulwadde bw'amannyo busukka ku butundutundu 4 ku 100 ate mu bakulu nga busukka ku 6 ku 100. Naye kaakati ngamba nti gy'emiwendo gye tekikyali nga gyegya kaakati kubanga nono research teyali mu bantu bonna mu Uganda, yali mu bantu balondemu. Kitegeeza singa tusobola okugenda tukola National Oral Health Survey ne tukebera buli ssekinnoomu twandisanga nga n'emiwendo gino girina mu 8 oba nga n'olusinza okwange gituuse mu meka mu 9 kubanga tutegeera nti obulwadde bw'amannyo bwo buli wamu. Mu baana lwaki obulwadde bw'amannyo buno bwetandisa okweyongera ennyo ensangi zino? Ekisooka nti abaana baffe ffe ng'abazadde tetumanyi migaso gya kulabira kamwa kaffe. Kati bye tutwale tugende tuwa abaana kiva ku ffe okwanga tewayigirizibwa biki tulina okulya, engeri bwe tuyonsa abaana baffe bye tulina okubawa ne mu masomero. Ne twesanga nga abazadde abasinga okusanyusa omwana amuwa swiiti, amuwa chocolate, amuwa soda, amuwa cake. Bino ebintu oyinza okusanga na bya layisi nnyo oba nusu nga 5 naye nga kyekigenda okuleetera omwana ono agenda kulwala amannyo. Twesange nti omwana wanaweereza emyaka 18 ng'amannyo agamu gano amakulu agatasobola kuddamu kukula nga gonna gavuddemu. Kati kyetukubiriza abazadde n'amasomero gonna agali eyo nti buno obubaka oluusi oyinza okuba tonaba kubuwuliriza. Kati bw'ojja ku eno expo ffe ng'abasawo b'amannyo abakugu tugenda kunnyonnyola engeri bw'ogenda okulabira omwana wo bw'omuyonsa oba ng'ovudde ku kuyonsa agamategateeka mu bboto obutongeramu sukaali, ebyo ebintu byonna bino ogenda kubisanga ate ku bwereere nga tetukugjeeko wadde n'enusu 10. So tubadde tukubiriza buli ssekinnoomu ali eyo ajje ku lunaku olwo wakati wa 13 ne 15 guno omwezi tusobole okubayamba n'okulabirira abaana baffe n'okukyusa engeri bwe tuliisa abaana baffe n'okulaba engeri bwe tusobola okutuuka nga ne ku myaka 7 buli mannyo gonna gakyalimu mu kamwa. That's it.
Uganda Healthcare Federation kyekigatta bannannyini mu byobulamu. In fact tukalagana bulungi n'abamannyo omukyala aba okwogerako nammwe. N'ekirala tuleeta n'abasawo n'abakola ku maaso n'amagumba. Ekikulu ennyo tukolagana bulungi ne ekitongole kya Ministry of Health, ekitongole eky'obulamu mu nsi eno ekifunye omukisa guno otugatta ffenna ne kiyita kampani eva mu Buyindi gye bayita STPIL bo kyebaleese kwekolaganamu ne Ministry of Health okuleeta kampani ezisukka mu 100 okujja okubeera nti wiiki ejja ng'ennaku 13 paka 15 mu mwezi guno tugenda kubeera ku Uma Showgrounds wali e Lugogo nga tugenda kutunula mu kintu kye bayita eddagala okuva okukola eddagala okutuuka no abalisaasaanya mu Uganda tulabe nti no abantu ba bulijjo abakola mu by'okujjanjaba n'abafuna eddagala eryo bategera bulungi kyekigenda mu maaso mu nsi eno mu ngeri gye basobola okufunamu eddagala eryo eddagala ettuufu mu Uganda. Ekirala abantu bagenda kufuna omukisa okubeera nti basobola obbakebeza amagumba amannyo amaaso n'abagezaako okuzaala abafunye obuzibu kampani zigenda kubeerayo obbakebera ku lw'obeereere okuva ku ssaawa 4 ez'okumakya paka ssaawa 12 ez'akawungeezi. Tusaba abantu ssekinoomu mu Uganda bonna bajje batwegatteko bafune omukisa guno okubeera nti basobola obbakebeza ku lw'obwereere okuyingira kwa bwereere tebagenda kusaba ssente guno omukisa tegubeerawo buli kaseera naye nga ffe twebaza nnyo minisitule y'obulamu okubeera nti ewadde abantu omukisa guno okubeerawo.
Online websites that use the outbreak of diseases to cause public anxiety and spread false information. So we would like to appeal to you to help us detect that fake information and verify it with the Ministry of Health, because a number of websites, mostly those that are online with faceless characters, tend to use this opportunity to mislead the public. So on behalf of the Ministry of Health, I wish to caution those that are spreading false information, and we shall work with the regulator, which is UCC, if this continues, and these websites will be ultimately be blocked or brought down. So we appeal to responsive reporting about the outbreaks, not to cause unnecessary anxiety among the members of the public. On the issue of reporting, if you have any symptoms that are consistent with the Ebola, you need to, these that include among others fever, rash, cough, difficulty in breathing, bleeding or bleeding from the various body openings, I appeal to you to report to the nearest health facility or call the Ministry of Health toll-free line, which is 0800 100 066. I repeat, 0800 100 066. That is the Ministry of Health toll-free line in case you have a person who has symptoms that are consistent with the Ebola virus disease. Ngenda mu lulimi Oluganda, njagala okusooka okwebaza kaaga ate njagala kuddamu nange kukaatiriza abalala bye boogedde nga nkubiriza abantu bonna bajje beetanire guno mwoleso. Ate tugenda kubeerayo n'okulaba nti tulina screening n'okulaba nti abantu babeera abanaaba mu ngalo ku exhibition ate bamaintaininga kyenandiise social distance. So nga guno mwoleko gugenda maaso tuli cognizant nti tulina okwetangira ebirwadde ate n'abalala ku workplaces tubakubiriza nti babeereko ne hand washing facilities oba sanitizers. So mwena abatuwuliriza abatulaba tubakubiriza okwetanira ku muno mwoleso, tuyige ku by'amadagala, enkola y'amadagala, ebyuma ebyekebeja ebirwadde ebiwera, n'abo bonna abagala okwolesa okufuna tekinologi omupya gwe basobola okukozesa mu malwaliro gabwe, tubakubiriza mujje mwetanire ku muno mwoleso. Mumbuzizaako ebikwata ku kirwadde kya Ebola, njagala kubategeeza nti Ministry y'obulamu erina obukugu obusoboka okulaba nti kino kirwadde tukiziisa mu budde butono nnyo. Bwe twogerera tumaze okulaba nti abantu abawera 234 tubasobodde okubagoberera ne tuba listinga nga contacts case gye yasooka gye twarangirira ewiiki eweddeko. Kwabo mu bivudde mu kwekebeja samples twaje kwabo abalina Uganda oba Uganda ko yafa ekirwadde kya Ebola, tuzudde ababiri abapya nga balina akawuka kano ka Ebola. Naye njagala kubategeeza nti bano already bali mu kufuna obujanjabi ate n'abalala kwabo 234 tuli mu kubeekebeja n'okubagoberera okulaba nti babeera mu quarantine okuyisa ennaku eza isolation bwe zigwa. Bwe banga teboleseza obubonero bw'ekirwadde kino tujja kuba nga tuba discharging abaddeyo. Naye bano abasinga nnyo abasawo baffe abali nga bakola nono omulwadde n'abamukolako mu malwaliro gye yagenda wano e Kampala, e Matuga ate ne Embale. So bonna bano tuli mu kubagoberera ate abazuuliddwa bo bali mu kufuna obujanjabi ku isolation gye tutaddeko emanyikibwa nga Ebola Treatment Unit. Njagala kukubiriza guno omulanga nti tubeera n'ebirwadde nga bino ebitiisa, waliwo abagufudde omuze okugenda ku mikutu gya social media n'emikutu gya tekinologiya emirala nga zi website okusasamaza abantu ne babawa amawulire ag'obulimba nga bagamba nti ekirwadde kyeyongedde nti wagenda beerayo lockdown. Nedda, Ministry y'ebyobulamu yerina obuvunaanyizibwa okubawa amawulire agakwatagana ku kirwadde kino. Ate bw'obanga mulabyeyo website ezisaasaanya ono information musobola otutegeeza nga Ministry y'ebyobulamu tulina obuvunaanyizibwa bw'okukolagana n'ekitongole kya UCC okulaba nti emikutu gino bagigyako ezenga esasamaza abannayuganda. So tubakubiriza nti mutuukirire Ministry y'ebyobulamu okufuna amawulire amatuufu. Ate njagala kukaatiriza nti Ministry y'ebyobulamu ya Uganda mu Africa yesingayo obukugu okulwanisa ebirwadde bino nga Ebola ne Marburg ne COVID. So temubeera n'okweralikirira kwenna, kino kirwadde tugenda kukimalako mu kaseera akatono nnyo. Naye tubakubiriza ati bw'oba ofunye omuntu ng'alabise n'obubonero bwenjogeddeko ng'okufulumya omusaayi okuva mu bitundu by'omubiri, alina olusujjasujja, alina lwashi, alina olukololo, okulaba nti mutegeeza eddwaliro eriri kumpi oba mukuba enamba nga sinsasulire ekitongole kya Ministry of Health ngeri noti 8 noti emu noti 6 ngenda jiddamu noti 8 noti emu noti 6. So bw'oba otuukiridde kweyo namba nga sinsasulire osobola okutegeeza omulwadde ono gyali, so tusobola okufuna ambulance emunona nemutwala awajanjabirwa abantu abalina ekirwadde kya Ebola. Naye tusooka n'okumuggyako muki samples ne tuzeekebeja. So mbategeezeza nti Ministry y'ebyobulamu erina obunaanyizibwa okulaba nti ewa amawulire ku kirwadde kino. Tetwagala abeetumiikiriza ne bagenda ne basasamaza abantu nga batadde misinformation ku mikutu gyabwe. Neyanziza nnyo ndowooza ebibuuzo byonna mbizeemu. Ab'amasomero ng'amasomero gaggulawo, tukolagana ne Ministry y'ebyenjigiriza n'egyemizannyo okulaba nti amasomero gateese standard operating procedures eziziiza ebirwadde bino mu malwaliro. Naye twagala n'okukubiriza ab'amasomero okulaba nti abaana b'essomero babategeeza ku signs and symptoms, obubonero, okulaba nti abaana bamanyi obubonero buno bw'ebino birwadde. Bwe banga wafunyeyo adevelopinze obubonero batutegeeze mangu. so bino byonna tubikola wamu. So twagala kubakubiriza nti Ministry y'ebyobulamu ekolagana ne Ministry y'ebyenjigiriza okulaba nti bino ebirwadde tebiyingira amasomero gaffe. Ate n'amasomero tugakubiriza okulaba nti information yenna akwatagana ku mpox ne Ebola bagiwa abaana b'essomero babategeeze nebyo balina okukola n'okulaba nti hand washing facilities amazzi ne sabuni weebiri mu masomero mu maklasi n'abaana gye basula okulaba nti buli kadde babeera nga banaaba mu ngalo ne sabuni n'amazzi. Mwebale.
Thank you so much, Emma, for such a wonderful update. Thank you, Madam Harriet, Madam Grace, Dr. Harriet, Dr. Maria, yes, and Mr.
And she's also the national liaison officer for the World Dental Federation. So she's international, definitely. On that, we also have Mr. Salik Tamar, the general manager, ETCPL.
In India and Uganda. ETCPL is an event organizing company conducting exhibition in over 40 countries around the globe in partnership with Ministry of Health and all our supporting partners. We are organizing 4th edition of Uganda Pharma and Healthcare International Exhibition. After the successful 3rd edition of Expo in 2024, we are back with our more vibrant exhibition covering in depth of various products and services in the pharma, medical and healthcare industry to facilitate the need of this sector in Uganda and East Africa. Uganda Pharma Healthcare International Exhibition will be held on 13 to 15 February, Thursday to Saturday at Uma Ground Multi-Purpose Hall, Lugogo, Kampala. The exhibition will be taking place on the 3-day from 10 a.m. to 6 p.m. The theme of exhibition is Innovation in Healthcare Shaping the Future of Pharma, Medical and Healthcare in Uganda. The scope of exhibition covers all products and services that fall under the sector of pharmaceutical, APIs, medical, surgical, healthcare, orthopedic, dental, medical, herbal, Ayush and more. Uganda Pharma and Healthcare is the biggest focused international expo in sector in Uganda. Uganda Pharma Healthcare 2025 has the support from all major stakeholders in this sector in Uganda. It is officially supported by Ministry of Health, Allied Health Professional Council, Uganda Healthcare Federation, Uganda Medical Association, Uganda Manufacturers Associations, Orthopedic Society of Uganda, and Dental Association. The exhibition is once again sponsored by Bliss GVS Pharma Limited, India, and Lanstra Enterprises Uganda Limited, our local partner in this exhibition. Uganda Pharma Healthcare International Expo 2025 will have 125 plus companies from different countries like Uganda, India, Egypt, Turkey, UAE, Kenya, Algeria, Pakistan, and others. The participants are manufacturers, dealers, and service providers from the board sector of pharma, medical, and healthcare sector. I am pleased to inform you all that official ceremony of exhibition will be taking place on 30th February 2025 from 10 a.m. onward at Multipurpose Hall in Uma Showground, Lugugu, Kampala. The show will be officially inaugurated in the esteemed presence of officials from Ministry of Health and other prominent partners, along with the presence of all our sponsors, exhibitors, and other visitors. Through this platform, as organizer, we urge all the business stakeholders, key figures, and companies in the pharma, medical, and healthcare industry to access and associate with our participant of all international expo. It provides the entire industry to opportunity to explore and engage with new product and technology in this sector. I would like to take this opportunity to spread awareness the various initiatives taking place during the exhibition. The entry for visitor in Uganda Pharma Healthcare 2025 is free of charge. Visitor will have access free eye checkup being conducted by Dr. Agarwal Eye Hospital and free orthopedic consultancy being conducted by Orthopedic Society of Uganda. Free IVF consultation being conducted by Chennai Fertility Center, India. Finally, I would like to conclude by thanking you all for being present at the official press conference today, and I look forward to welcome you all at the exhibition next week. Thank you very much. Thanks again.
Healthcare Focused International Exhibition. I'm Dr. Nacho Maria Goretti, and I'm coming in as the Publicity Secretary for the Uganda Dental Association and also as the National Liaison Officer for the World Dental Federation in Uganda. As the Uganda Dental Association, we are a body that is non-governmental, and our role is basically to promote oral health care across our country, Uganda. And this is an opportunity for us to engage with pharma health care so that we are able to deliver these services for free at no cost from 13th to 15th. We hope to promote our oral health care, one, by providing oral health education to the people that are going to visit at the exhibition for free. At the same time, we are also going to offer free consultations. So we are going to check your mouth and see if there are any issues. If you've never been to the dentist, this is the best time for you to come and access these services free of charge. So we are encouraging and motivating all Ugandans out there, as our guest has told us, that it's going to be free of charge to access all these services. We, as the Dental Association of Uganda, we welcome all Ugandans to be part of this. And we are glad that, we hope that on 13th to 15th, we shall have very large numbers at the queue for the dental services. Yeah, thank you very much.
Doctor, can you take the honor to invite Madam Grace and Chiwanuka also address us?
Morning, everybody. Thank you for joining us this morning. I know there's a lot going on in the country when it comes to health, but I wanted to also just make a highlight of why this becomes an important event for us to be a part of and to participate in. As you all know, Uganda Healthcare Federation is an umbrella body for the private health sector. And what we do is we bring together different areas of the private sector, not only people who prescribe medicines, but also industrialists that manufacture them, and also the consumers that consume them in the different outlets across the country. As Uganda, we have been positioning ourselves as a regional hub when it comes to health. And when you look at the investments that have been made in health over the last 20 years, we have made sure that not only do we have a pharmaceutical hub that is coming up very strongly, but we're also making sure that we're training our personnel on how to use technology to be able to manage our supply chain logistics better. And this is articulated in our supply chain roadmap that was recently launched by the Ministry of Health. So this is an opportunity for us to tie all those pieces together and give Ugandans an opportunity that they would not ordinarily get without going to the 6 different countries that are partnering with us to have this event. This unique opportunity allows us to bring all these stakeholders from the different countries together, to allow them to network, to learn from each other, and to see how we can spur growth in the pharmaceutical sector in Uganda so that we can do more for our citizens without having to allow for a deficit that forces them to travel outside of the country to access medicines, commodities, and other supplies that are essential to our health system. Of late, we have seen that our country has evolved and gravitated more towards digital health, and we're trying to see how we can invest in manufacturing more locally. This is an opportunity for us to see how we can bring the different important pillars in pharmacy together, not only those that are putting together essential medicines, but medicines that speak to non-communicable diseases, so that as we see the growth in our population, not only being able to diagnose non-communicable diseases, but we're also able to see how we can domestically provide the solutions they need for those challenges. So we're inviting all stakeholders to join us for this event to learn. There's something for everybody to learn, there's something for everybody to hear, and there's something for everybody to benefit. Not only the everyday health consumer that is going to participate in the different services and screenings that are going to be available, but business and investors, those business players that have invested in health, especially in the pharmaceutical sector. And with that, I thank you, and I invite Dr. Emma from the Ministry of Health to speak to you. Thank you.
We welcome you to today's press briefing by the Ministry of Health with our partners here to talk about the Uganda Pharma and Healthcare International Expo, which will be running from Thursday 13th February to Saturday 15th February 2025 at the Multipurpose Hall in the Uma Showgrounds in Rugogo. And this expo will be running daily from 10 a.m. to 6 p.m. It's already been emphasized that it is free of charge. And as you are aware, ETSIPL is a leading organizer and promoter from India, handling over 50 exhibitions in year around the world. Exhibitions and Trade Services India has organized this exhibition here in Uganda to promote the industry and exhaust untapped opportunities. As you're already aware, we are in high plans of setting up an industrial park in Nakasongola for the pharmaceutical sector, and this is an opportunity to attract a number of manufacturers who will be attending this expo. And we hope that this will further encourage and open up Uganda as an investment destination as far as local manufacturing, because we are moving towards having a number of medical sundries and medicines manufactured here in the country. We are in discussions to have things like vaccines, diagnostics. I know there are already companies that are making a number of health-related products in Namave, and this is a move in right direction. So this Uganda Pharma Healthcare International Expo 2025 will focus on manufacturers, suppliers of pharmaceuticals, health technologies, diagnostics, equipment and devices, orthopedic, health service institutions, government ministries, departments and agencies, importers, exporters, policy and decision makers, and medical practitioners within the East African region and around the world, and which is a great platform in this health sector. The Trade Expo, as already indicated, is scheduled to take place at the Uma Showgrounds in Kampala, Uganda and it will bring a different sphere of prayers in this field. We are this year under this 4th edition, running under the theme, Innovations in Healthcare, Shaping the Future of Pharma and Healthcare in Uganda. And this year's theme is relevant to Uganda's health sector, positioned to address tomorrow's challenge. The theme rallies both local and international community to identify innovative ways of doing business, like dealing with policy challenges, closing the gaps in technologies, and also deliberate national innovation systems to foster technological progress. The theme calls upon all industrial practitioners to put in place technologies at the center of development by creating awareness and promoting innovative approaches, as well as building sustainable collaborations. I am glad that I have a representative from the Quality Assurance of the Pharmacy and Natural Medicines Department of the Ministry of Health. Harriet, you're welcome, and you'll be able to respond to the technical questions that will arise regarding the pharmaceutical sector in the country. As I said, this expo is supported by partners that include Uganda Manufacturers Association, the Allied Health Professionals Council, Uganda Medical and Dental Practitioners Council, Uganda Medical Association, Uganda Healthcare Federation, Orthopedic Society of Uganda, Uganda Dental Association, which will enhance mission to provide comprehensive platform to enable growth in the sector in Uganda. As earlier highlighted, I wish to emphasize that we have a number of exhibitors, over 120, from several countries that include Uganda, India, the United Arab Emirates, Egypt, Pakistan, Kenya, Turkey, and other countries. The guest of honor at the opening ceremony, which will take place next week, will be the Minister of Health. I beg to stop here, and we take on any questions. Thank you very much.
Thank you so much, Mama.